Okay, good afternoon, everyone. We're waiting for participants to be here. Good afternoon, sir.
Good afternoon. Nice meeting you. I'm set already. So can you hear me? Let me know if you can hear me.
Yes, I can hear you.
It's loud and clear, right?
You're welcome to Aspire program with Farmalad
Thank you
as we are
so much.
waiting for our participants to join us soon.
No problem. Nice meeting you at Farm Alert. And thank you for this opportunity once again.
Okay. Okay.
So am I going to share my
So you're
screen?
welcome for now. No, we have to
Oh,
wait for the participants.
it's okay.
Yes. Okay. Good afternoon, everyone. You're welcome to another session of Farm Alert Aspire program. It's going to be an interactive session because we'll be having a lot of participants participating today for this session. As the topic for discussion today, it's career opportunity for veterinarians and other health professionals. Thank you for joining us. My name is Dr. Zainab Abdullah Isiu, an outlier from the University of Maiduguri. From the University of Maiduguri, and I will be your facilitator as well as your moderator for today, alongside Dr. Adamusa Idu. Okay, I think his network or something like that. Alongside Dr. Adamusa Idu Saleh, a PhD holder, a passionate senior academic lecturer from the University of Maiduguri with 8+ working experience. He is a public health specialist and epidemiologist, IPC and biorisk management consultant, a researcher with many publications, both local and international. He has so many field experience upon which are the outbreak investigation with coronavirus, Lassa fever, and cholera outbreak, as well as he has engaged in so many national survey, including the National Center for Disease Control and World Health Organization. So you're welcome, sir. You'll be having 15 minutes to tell us to discuss about career opportunity for veterinarians and other health professionals. And at the end of this session, it's going to be a question session whereby our participants will ask questions that will direct it to you, sir, Dr. Adamu Saidu Sali, our hub expert for today. So you're welcome, sir. Thank you for joining us, and hope it's going to be an interactive session. So as I hand over the mic to you, sir, you're having 15 minutes. Thank you.
I'm Saleh Saidu, a senior lecturer from the University of Maiduguri. So once again, good afternoon, everyone. My senior colleagues, and other personalities. So without taking much of your time, I would like to thank the organizers, that's Farm Alert, the moderator, Dr. Zainab, and the participants for giving me this opportunity to share the little experience I have in the field of public health and other side careers opportunities. So before I start the presentation, I would like to say one or two because when you are talking about the career opportunities, it's an area that is need to discuss on that because of the needs. Most of the youths or veterinarians, to be specific, these days are hanging behind. After graduation, they don't know where to go next. And that's what urged me to choose this topic. And thank you for allowing me to say one or two things. So can you share my slides or I should go ahead and do it from this end? I don't know. Can you hear me? Okay, Dr. Zainab, can you hear me?
Yes, I can hear you.
So are you going to share my slide or I have to do it from this end? Let me know.
Yes, he will, Mr. Jerry. Yes.
It's okay. So while waiting for him to do that, to save time, let me just keep talking on the same issue. So I have
Oh,
said earlier, this today's topic, career talks or career opportunities for veterinarians and other health professionals. So with the advent of many technologies and the issue of One Health around the global health security in the world, there are many opportunities coming up, especially for veterinarians. There were not before. I could remember in recent time, just 10 years back, there are programs or opportunities that were not there, but now they are currently available for veterinarians to go there and participate and fulfill their own quota of professionality. So while presenting the paper or the short note I have on that, I will expatiate on that. So this issue of One Health is has the idea came up because of the issues around emerging and emerging zoonosis. The war is encompassing, is beyond the veterinarians and medic, meaning the two professionals and many others biomedical professionals have to come together, put head together, share experience, and to know how to tackle this emerging and emerging zoonosis in an agenda of international health regulation that was signed in 2005. So that's just it. And before that, the issue of coming together as professionals started somewhere around 2007, almost a decade. And the challenges is more in sub-Saharan Africa, including Nigeria. So with the coming of the NCDC and other institutions in the country, it has opened up opportunities for veterinarians to participate. One of the common one is this FELTIF program that involves the veterinarians, the human medic, as well as the other laboratory scientists. So to cut it short, I think I can go ahead with the presentations if I'm audible enough. Can you confirm if you can hear me? Hello?
yes, sir. We can
Okay,
hear you. We can hear you. Thank you.
okay. So, so as I was saying, these are the two major things that contributed to the issue of One Health and created more opportunities for veterinarians and other health professionals. The issue of One Health and the issue around emerging and emerging infectious diseases that need collaboration and coordinations among healthcare workers to come together, strengthen the surveillance and other things around to fight those global challenges. And yeah, now I can see my slide. So by way of introduction, I think I will be a little bit biased in this regard because the topic says career opportunities for veterinarians and other health professionals. So I think I would like to tell us more about who are veterinarians, their role in the society before going proper to the topic proper. So we all know veterinarians, they play a critical role in animal healthcare and animal handling and controlling animal diseases. So they have a wide range of career opportunities available to them these days, as I mentioned in my introduction. So to cut it short, there are opportunities that are already known to veterinarians. Maybe I will start by them. Later on, I will shed more light on that. So I'll be rushing on these non-issues. So one of the opportunities of veterinarians is, of course, clinical practice. So many veterinarians work in private clinical practices, public, private, public and private clinical settings in the country, where they diagnose, treat, and take care of animals, especially the physical illnesses and injuries. And with that, they may specialize in specific areas based on the type of animals which you know better. We have small animal expertise who can take care of pets, especially dogs and cats. And we have large animal experts handling equine medicine as well as large ruminants, especially cattle, and some other exotic animals and wildlife. So these are the clinical practices or area of specialities which veterinarians play a vital role and is one of the opportunities. Then secondly, research. If I say research here, it may be, it's encompassing anyway. Veterinarians can pursue careers in research, conducting cross-sectional studies, research, observational studies, research to advance their understanding of diseases. In that line, they develop new treatment and improve animal health. So this can be in academic institution because that's where research are. It can be in government agencies, especially research institutes. If not that one, I mean MBRI BOM, you know, Institute of Medical Sciences. With the advent of the new private research organizations, now veterinarians are one of the key personnel and they play a vital role in pushing their research to a higher length. Of course, public health is another career opportunity for veterinarians, and veterinarians play a crucial role in ensuring public health by monitoring and controlling the spread of diseases that can spread from animals to humans, as defined by experts. Let me give you a sure-based definition and that of WHO, that any disease of animal origin affecting humans or diseases that are transmissible between vertebrate animals and man. This is what they call zoonotic diseases. So veterinarians play a vital role in public health interventions these days. It's a career opportunity that many veterinarians don't know. So you have to open your eyes, look around. You know, whenever you see a public health program being advertised, that not exclude veterinarians, even if you are not captured in the adverts. So it's another room for you, especially with the issue of collaboration around the One Health agenda toward ensuring global health security. So this CDC and WHO are the intergovernmental agencies that are helping this collaboration to go further. And veterinarians are doing well. I can give you an instance here, but let me just short because of time. There was a public health response I participated. That was COVID and Lassa in 2020, 2021, respectively. So out of the 10 members of the team, 7 of us were veterinarians, with only 2 medic and 1 lab scientist. You see how veterinarians are. And to your surprise, veterinarians play a vital role then in curtailing the disease to the situation we are now. So next, I have a lot of instances to mention here, but maybe when during question and answers, I will shed more light on that. Then another career opportunity for veterinarians is food safety and inspection. There are institutes that are saddled with the responsibility of ensuring food are safe and wholesome for human consumption. The aim is one, to ensure public health is protected. So some veterinarians work in the food industry, as you know, to ensure the safety of animal-derived food products, to avoid foodborne pathogens. So they are one of the emerging areas now. Foodborne pathogens is one of the emerging areas globally agreed on that affects sub-Saharan African countries, Southeast Asian countries, and other middle income countries around the globe. So veterinarians play a vital role, and this is another opportunity for them to key in and participate. What they do there, they inspect food production facilities, they monitor animal health on farms, and enforce regulations to prevent the spread of disease through food chain. If you know that one, through food chain. How they do that? Because they had better knowledge of the Codex Alimentarius Commission. They are the commission that provide the standards toward ensuring food safety, especially of animal origin derived from animal and animal products. So that's that. So I don't want to say much on that. We have places like NAFDAC, in Nigeria. That's the most common and more familiar to all of us here. Of course, we have a veterinary pathology. Veterinary pathology is a department or specialty in veterinary medicine, of course. So veterinary pathologists examine animal tissues and fluid to diagnose diseases and understand the causes of animal illnesses. So they often work in diagnostic laboratories or research settings, as I mentioned earlier in the research section of this presentation, so I don't need to say much on that. So one key emphasis here is, as a veterinary pathologist, you are responsible for doing PM and even including antemortem in some cases to come up with the definitive diagnosis of a disease. Let me give you an instance now. Now that we have anthrax around the country, in some states they have recorded some cases. So it's veterinarian that will know how to do diagnosis on animal using PM skills and whatever to tell you or to guide the team on where to go. So this is your opportunity. Don't allow other people to hijack while you see or you hold your arms and just looking at them. It's your opportunity. When we are talking of diseases of animal origin, anthrax is one of them. If you remember, it's number one on the list of OIE, diseases. So it's your concern and you know better on that. You have opportunities around that place as veterinary pathologist. Then veterinary dentistry. So this is specifically for veterinarians. Other specials or experts are not allowed to come in. This is strictly for veterinarians because some veterinarians can specialize, to focus on dental health in animals, performing procedures and surgeries related to oral health. This is not common here, but it gives a lot of money, especially if you are running a private practice in developed countries. I have seen one in UK, I have seen one in India, I have seen one in Qatar. They have expert known as veterinary dentistry. If you see how they do that cosmetic approaches on horses, equines, it may interest you and they earn a lot of money. So I think this is also coming up here with places in Abuja and other practices, private practice growing in the country. Then equine medicine as well. Veterinarians that specialize in equine medicine, their work primarily is with horses. That is most common here, and providing medical care to those species, performing surgeries from simple to complex surgeries, and managing equine health, of course. So this is strictly for veterinarians. No argument on that. Then wildlife conservation. It's one of the issues around the globe now because some animals are going on extinction, if you don't know that one. So the need for veterinarians to go into wildlife conservation is always at the increase. So veterinarians work in the field to protect and conserve wildlife populations. Otherwise, things will go somehow. So they involve in research, this monitoring, rehabilitation of injured and endangered species, as I mentioned earlier. So you don't allow certain species to go extinct, meaning they will no longer be available. So veterinarians are needed in this aspect and they are doing well. Then emergency and critical care. Some veterinarians specialize in emergency medicine, working in 247 animal hospitals to provide urgent care to sick or injured animals, especially in automobile accidents that involve animals. There are hotlines, isn't it, that you can reach out to veterinarians easily. This is in organized countries. Sorry to say, I have to say it's not positive anyway. In this country, we don't have one, but it's government should provide an emergency and critical care. It's just like fixed post clinics for humans. So with the same thing we have for animals as well, and veterinarians play a vital role in that regard. Then teaching and academia, of course. I'm from academics. I know what veterinarians do in academics. So many veterinarians become educators now, teaching future veterinarians in veterinary schools and colleges. You see it very short, but the item is very bulky if you have to translate it. So veterinarians are now, playing a significant role in what providing skills in biomedical sciences, not only veterinary faculties. I know as I'm speaking now, I'm taking courses in what? In pharmacy, postgraduates, in biotechnology center, as well as School of Sciences, especially microbiology. I have students supervising, so veterinarians are everywhere because of the training you have been receiving right from undergraduate or to postgraduate levels. So you have a lot of contribution in academia. Then shelter medicine, I don't need to say much on this. Veterinarians in this will provide medical care to animals in animal shelters, rescue organizations, and human societies. This one is especially significant in countries that are recording natural disasters such as earthquake. So in these days, they make an animal component whereby veterinarians are engaged to rescue animals, provide shelters to them, how to take care of them in the first 24 hours of the disaster, things like that, to ensure animal health is what protected. Then, of course, government and regulatory agencies. So, veterinary work for government agencies like the United States Department of Drug Administration or FDA. These are just examples. In Nigeria, we have NAFDAC. In India, we have FSSA. It's a food safety organization responsible for ensuring food safety, especially by protecting animal welfare and disease control. So by doing that, the food animals will not get infected, will not get disease, and that way you can ensure food safety. And you tackle the spread of disease through food chain. That's that. So veterinarians play a vital role in that, regulatory agencies. Then One Health initiatives. I already mentioned this during my introduction, but One Health approach recognizes the interconnections, or if you like, multidisciplinary approach of human, animal, and environmental health all together. So veterinarians can play a vital role in this interdisciplinary effort of addressing complex health challenges, especially with the emergence of this issue of emerging and emerging zoonosis. Most of the issues behind this are anthropogenic activities, meaning human activities, global warming, emission of natural greenhouse gases emissions due to our activities, day-to-day activities. So all these are things that would affect the environmental health. Environment can go sick. Many people don't know. We and our animals live in the same environment. We share the same ecosystem. So veterinarians know better, especially with their knowledge of animal background. They play a vital role significantly for One Health because it has been speculated that about 60 to 75 uh, emerging and emerging zoonoses are from animals. So that's what makes veterinarians important in that regard, and it's an opportunity for us to key in. Yeah, telemedicine, with the advent of technology, yeah, some veterinarians offer telemedicine services, providing consultations and services to pet owners remotely. So this is an important area. I have seen a platform developed by one Indian. I cannot remember the exact name, but what he does, he provides telemedicine. You subscribe, you pay him online, he'll give you an expert consultation, especially on his areas of expertise. So veterinarians or fresh graduates that finish without having something doing, this is an initiative that you can key in. Instead of you just wasting your time on social media, sorry to say, it's not a waste of time to some, but others take it just like a hobby. You don't have time to waste anymore. You can go for telemedicine. You can get money out of it. This is an area. Then consulting. Veterinarians can work as consultant for various industries, provide their expertise, such as animal husbandry, disease prevention, healthcare management. So don't narrow your thinking, please. It's high time to start thinking beyond the DVM qualifications. You can do a lot of things. There are organizations that need veterinarians, but many people don't know. Please keep applying. I think with this small information, it will enlighten your brain or you are thinking on how to expand your career opportunities. Then non-profit organizations. Here they are also known as NGOs. So many NGOs, such as animal welfare organizations and international aid groups, employ veterinarians to provide care to animals in need. I know of Intersource. Some years back, they contacted me that they need an expert on animal health. That's, of course, a veterinarian. Specifically, they want to post into a place. I remember it was around Damasak, where there were a displacement of people and animals. They want to install, in collaboration with the FAO, project on livestock restoration in the Northeast Zone. So all these are opportunities for veterinarians in NGOs. So these are just few of the career opportunities available to veterinarians. The specific part to veterinarians can depend on their interests, skills, and specializations. Of course, you cannot go for all the aforementioned opportunities at once. Interest is something to consider. Once you have interest in something, you can perfect that and you do justice to the topic. So these are few things I can say. So to make it clear, because of the topic or title, it says veterinarians and other professionals. So I found it interesting to specifically mention some of the career opportunities for veterinarians and some for other health professionals. With that, I mentioned one item as opportunities for veterinarians. So the clinical practice is one. This is the most common career path for veterinarians. We all know that you work in the clinics, being private or public, the hospitals. I believe we know what is clinics, what is hospitals. So we don't need to know or veterinary practices, be it private or whatever, to provide healthcare services to animals, including diagnosis. And so these days, veterinarians can give a laboratory diagnosis, especially of animal diseases, to the public. It's another area that was not common before. Then specialized veterinary medicine. These days, we have a specialty course under BCN. We call it Fellow College of Veterinary Surgeons. They can give you a fellowship qualification, which is an additional qualification. You can be a surgeon, internal medicine expert, dermatology, oncology, ophthalmologist, and many more specialities, which you can open up your own small clinic or hospital, depending on your capability, and you can get money. This specifically for veterinarians. Then veterinary research. Apart from the research mentioned earlier, which is a broad term, there are specific research for veterinary profession, conducting research in areas like animal disease, genetic, pharmaceuticals, nutrition, and even this genetic engineering involving improvement toward animal health and production. All these are areas of research specific to veterinarians. Of course, public health is the same thing I mentioned earlier, so I don't need to waste time on that. If I say public health, is strictly on zoonotic diseases that can be spread from animal to humans and ensuring safety of the food supply, especially the one from animal origin. So veterinarians can work there and contribute their share, especially in CDC and in food safety and inspection institutes. Then wildlife and conservation. I mentioned that earlier, veterinarians play a critical role in conserving wildlife. So I don't need to say something on emergency and critical care. That has been mentioned earlier. Likewise, teaching and academia. All these are specific for veterinarians. It's only veterinarians that can teach in faculty of veterinary medicines. Other health professionals are not allowed to. But jokingly or on the serious note, veterinarians can go to any other faculties, while the other health professionals cannot do that. Maybe I'm a little biased on that. So it's something we should be proud of. Veterinarians are everywhere. You are hardworking. You have a complex knowledge that you can contribute to other biomedical sciences, especially biochemistry aspect of it, the physiology, microbiology, you mentioned few. So then there are other career opportunities that you know other professionals can key in and you share it on. So pharmaceutical industries, veterinarians can work in pharmaceutical companies. I know of a colleague who is working with the pharmaceutical industry as a representative. So he handles veterinary drugs specifically and other things. So to short time, maybe the next item is BO2. So can you move to the next slide? Just scroll down. So the other, yeah, here, please, hello, can you move on? So the other things I wanted to say more on is the other career opportunities for veterinarians and other health workers because I have said all for what veterinarians can go in. Please scroll down. When you reach there, I'll stop you. So all these I mentioned them earlier, so we don't need to waste time on that. Yeah, keep moving, keep moving. Yes, here it's okay. So there are opportunities for medical doctors, physicians. Sorry to say we don't have one here, but physicians can work in various clinical settings, including hospitals, being in private practice clinics, community health centers, providing medical care to patients, you know, and it's good to have some background knowledge on disease of animal origins as clinical experts. So you think of possibility of getting zoonotic, especially if you look at the occupational history of the clients or patients in that regard, it guide you. This is an opportunity for them. And also the advent of One Health, they can widen their knowledge in that regard by knowing some of the zoonotic diseases, especially brucellosis, urban tuberculosis. They also have their own specialty. You can be a cardiologist, oncologist, neurologist. You can be a pediatrician or a surgeon or a psychiatric expert and many other disciplines now. With the issue of psychiatry now, I know of NGO that are looking for experts that specialize on mental health and psychosocial support. And they pay a lot of money to them. They don't take veterinarians in that. It's strictly for, so when you see advert on that, please don't apply as a veterinarian. It doesn't need your DBM or masters. It's strictly for MBBS and a specialty on psychiatry. So then hospital medicine, this focus on providing care to patients with hospital settings, managing inpatient cases as case managers. Of course, they also have their own telemedicine. So as I mentioned earlier, with the advancement of technology, the use of this telemedicine is becoming widely spread now. Many doctors offer telemedicine services online, providing consultations and healthcare advice remotely. Of course, it's not for free, isn't it? Even if you are buying data, they have their own share. And of course, sometimes they have their own way of charging you online. You have to put your details, get paid before they provide services for you. Next. So then, of course, One Health, that's another, yeah, academia and research. Yeah, most of the other health professionals, especially medics and lab scientists, they are conducting medical research at universities level, and medical schools or colleges, and of course research institutions. They play their role there as medic or as lab scientists or as pharmacists, whatever profession you are in. So public health is for all. Let me put it this way. Veterinarians can come in, medics can come in, lab technicians, everybody has a place. So these days, even environmental health experts, can come under One Health, public health issue. And there are a lot of agencies regulating that. Of course, WHO in addressing population health issues, disease prevention, and health policy development to guide the public. So another one thing, which is a global health, if you see, global health is more of one thing. It's engaging in international health efforts, providing medical care in on the SEPT regions, especially sub-Saharan Africa and Southeast Asian countries, including Bhutan, Indians, Pakistans, a lot of them. They are backward in development, and the global health is what interested in touching those areas. So this is for veterinarians as well as other health professionals. Then healthcare administration, of course, managing healthcare organizations, being hospital, a healthcare system, including roles of hospital administration, needs or require people with health backgrounds. In this case, veterinarians can come in. I know of a veterinary doctor in Ilorin who is currently the ED, the executive director of the National Family Healthcare Agency of the states. That Dr. Nusrat, if you know her, she's a veterinarian, so she's a healthcare administrator now. So this a key opportunity for veterinarians. Don't narrow your thinking. You can go in, especially if you have the skills. So don't try to apply for this kind of job if you have DBM, but with additional qualification you can key in. Then pharmaceutical and medical device industry. Yeah, this like with your background in pharmacology, as a veterinarian you can come in here, but specifically it's for pharmaceutical scientists, pharmacists, pharmacy technicians, if you know them. This is specifically for them. But in the absence of any veterinarians and medical doctors can key in. Then HEL IT. IT stands for information technology. So to get working on healthcare technology and electronic medical record systems to ensure efficient and to secure data management related to health is another opportunity for all other health professionals, including veterinarians. They do that. So in nutshell, both veterinarians and medical doctors, together with other health professionals, they have a multitude or a lot of career options to choose from their own interest. I mentioned earlier that interest is key because if you don't have interest in the career you are in, you may end up failing or not succeeding at all. So interest in choosing career is very important. It's key in what? In success toward that area of specialization you're choosing or you're going into. So the healthcare industry continues to evolve, as you know better, offering new opportunities and of course with their own challenges to professionals in both fields. So additionally, interdisciplinary collaboration between veterinarians and medical doctors is increasingly recognized as valuable for addressing complex health issues, especially the one around the emerging and re-emerging zoonotic diseases and issues toward sustainable development goals, especially the one toward on ensuring health, global health security in line with international health regulations of 2005. So all professionals, including veterinarians, have to come together, put it together to tackle that global burden. So that's all I have to contribute. There are a lot of opportunities I didn't capture because of time given to me, but maybe during the question and answer session, I'll shed more light on that or I'll mention one or two things. So thank you all for listening and thank you for your time and over.
Okay. Thank you to our Hope expert, Dr. Adamu Saidu Saleh, for sharing this with us. I hope we all have gained a lot of knowledge about it because veterinarians are everywhere and they can engage themselves in different kinds of job opportunities out there waiting for you. So the room is now open for comments and question sessions for the participants, as I will read it and direct it to our hub expert. Okay. Okay. Nancy Akinlichi said, is there any criteria for joining NAFDAC as a veterinarian, sir?
Yeah. So can I take it one by one or take at a go? Which one do you like? I should take it one by one.
One after the other.
It's okay. So as I mentioned earlier, there are job opportunities that are specifically for specializations. while things around NAFDAC and regulatory agencies, with your DVM, you can get in. That's just it. Don't underrate your DVM qualification. It's a terminal degree as per career guidelines. So DVM qualification is a what? It's enough to get into regulatory agencies like NAFDAC and other institutes, including the academia. So there is no restriction on that, especially with the advent of a new directorate of veterinary medicine in NAFDAC now. Before there was no one. Now we have a directorate, meaning you can establish a career there up to director's level. That's what it means. If you have a directorate in a cadre, means you can excel up to the highest point in that regard. So thank you so much. I don't know if I answered that question. Thank you and over.
Okay, thank you. There is another question from Gold Ijeoma. She said she is interested in NGOs. How can I identify with them?
Yeah. So thank you. This is a very interesting question and I like it. So NGOs are not everywhere. So most of the NGOs they have in mind or they have as a goal to tackle humanitarian crisis. So you mostly see them around the conflict affected regions. There are many in Maiduguri or in Bay State. You know Bay State or you never heard it before? Bay State stands for Borno, Adamawa, and Yobe. So as per UN guideline, these are the conflict affected regions in the Northeast. So you can see a lot of NGOs there. So this is an opportunity for you. That's why you can get NGOs. And for you to know which NGOs, interested in employing the services of veterinarians, it's up to you. You have to be current. I mentioned few of them while presenting. We have WHO, we have FAO, and other international NGOs. We call them INGOs. Like I mentioned Intersource, I mentioned GIS. I don't know if you are writing, they're very important. There are instances I saw an advert specifically looking for veterinarians, they are not interested in applying. So I refer to some colleagues that need job, because the pay was not enough for me and it's not for me specifically. Sorry, I'm big for that. So GIS, FAO, Intersource, MESICOF, Save the Children, IOM, all UN-based agencies, employ veterinarians and they need the services of veterinarians. To cut the story short, but if you are in Lagos, you cannot get NGOs unless those NGOs that are residing in that place. I don't know if I have answered your questions deliciously.
Okay, thank you. Here is another question from Nancy. Can fresh veterinarians get jobs as lecturers immediately after schooling?
Yes, they can get. Let me take it short and brief. So with the review of the curriculum of Civil Service Commission in Nigeria, now before veterinarians can start as assistant lecturers, if you had it before, but now the minimum level you can start is lecturer 2. If you don't know, these are information for you, meaning with your DVM, you can start what? As lecturer 2. Unlike the other faculties in the university or in academia, whereby the minimum level you can start is what? Assistant lecturer or graduate assistant, depending. So veterinarians are always on top. So thank you. I don't know if that is okay.
Okay. Um, okay. Thank you. There is another, I don't know if it's a question. She said that from Uchechi Gift. You mentioned that we keep sending out our application for different job roles available, especially the global bodies.
Can you come again? I missed some of the questions. Sorry. Can you read it again?
Okay, she said that you mentioned that we keep sending out our applications for different job roles available, especially the global bodies.
Yeah. So the issue of employment or being selected after applying
Okay, I
is
think
something
you have
else.
answered.
I've answered that one.
Okay. Okay, she was asking like how do we pattern our applications or CV for those roles, especially the global bodies?
Okay. So if I got you right, the global bodies, you mean the international organizations, especially UN based. So this is a very nice question. I like it. The way we write our CVs need to change because most of the people write what is not needed. First of all, if you look at their advert, it comes in what terms of reference, and the requirements. So when you are writing CV or cover letter, these are two different things that most organizations ask. They ask you to submit your CV and a cover letter. So most of the times, the cover letter should be one pager, because they don't have time to be reading stories. And CV should be at least one page for DVM or two pages at most, isn't it? And it should be in bullet points, you know, meaning you have DVM, put DA, you got your DVM, isn't it? Don't put stories in between. Be specific, write a word, clean and clear CV that can attract, the human resource to select you out of hundreds or out of many out there that apply for the job, isn't it? So writing CVs and cover letters in application of a job is very important, especially these days with a quite good number of applicants. You apply for, you see when you make advert that need only 10 candidates, you see thousands applying. At least, so you need to sell yourself out, isn't it? Though the issue of who you know sometimes works, but I don't believe in that. Actually, sorry to say about that. Maybe there are things that works somehow beyond my knowledge, but know how to improve your CV and cover letter. Thank you all.
Okay, thank you, sir. Here's another question from Hawa Abubakar. She said, good afternoon, sir. Sorry for disturbing you again. Can you please list the NGOs again?
Okay, thank you, Howard. There's no worry about it. So I made mention of the WHO, the FAO, the OIE. We don't have OIE around, but OIE is another one. World Food Program, WFP, IOM. I know of many veterinarians that are still working under IOM as hygiene promoters. Please write that one specifically, hygiene promoters. They do employ vets as hygiene promoters with good pay. Let me tell you that. And INGOs, Intersos, Mesicov, GIS, that's they call it GIS or GIZ, sorry, they do employ veterinarians as well. There are a lot of them out there that do employ veterinarians, to mention few, but keep searching. So there are something job alerts. Sorry, that I forgot to mention. So if you subscribe to job alerts, it's a platform that you see daily adverts of most of the what NGOs. So I encourage you to do that. Another platform is Humanitarian Job 8. Humanitarian Job 8. I hope you are writing. This another platform that you can get in and get adverts on daily basis. Thank you so much.
Okay. Okay, here is another question from Nancy. Can vets focus on vet business, sir?
Yeah, why not? Vet business means we mean like selling drugs, selling animal feed, you know, things like that. Maybe if I'm asking you again, of course, you are the best people to go. We call this a private practice, isn't it? Private practice doesn't mean you must treat animals, isn't it? You can involve in selling animal drugs, vaccines for you, you know, small animal, items, like collar, things like that. So all these are opportunities for veterinarians, especially those that want to go for private bed practice. So thank you for that questions. So Dr. Zeno, can you allow me to bring my charger? 1 minute, can I take it?
Okay, sir. Okay, you can keep on sharing your comments and questions. While we are waiting for Dr. Adamu Saleh, you can keep on sharing this on your YouTube to your friends and families to watch and other veterinarians. I hope you're learning and gaining a lot of knowledge about career opportunity, and I hope this is interesting.
Hello.
Okay, I think he's back.
Yeah, I'm back, but let me plug. Sorry, I don't want to.
Okay, okay, I can see a lot of questions down there. Okay.
I'm having warnings on my
Okay,
battery.
okay, you're welcome back, sir.
Yeah, thank you so much.
You're welcome back. Okay, here's another question from Musa Ismail Rua. He said, Sir, are there scholarship opportunities for further studies for fresh veterinarians?
Yeah, this is a very nice question. I like it. It's one of the abundant areas. People don't think that So veterinarians are lucky. They have many opportunities when it comes to scholarship to further your studies abroad. So let me mention few. We have BEA, bilateral educational agreement, is an opportunity with the Federal Ministry of Education under Scholarship Board, Federal Scholarship Board, Ministry of Education. They provide this annually. We have Commonwealth Scholarship Commission, CSC, is also with the Federal Ministry of Health, Federal Scholarship Board. So now it's online. You apply online. They are specific. So BE is bilateral agreement, meaning Nigeria is in agreement with other countries, especially Russia. You can go and further your studies from master's degree up to PhD. So opportunities are there. Once you apply, they call for an interview. When you scale through, you can get one. Commonwealth. Then we have ICCR. I'm a fellow of ICCR now. Indian Council for Cultural Relations is 100% scholarship. They call it Commonwealth Scholarship for Africans. And they call it ICCR. I don't know if you are writing it. So ICCR comes around July, August every year. Commonwealth Scholarship comes around October, November. Every year. I saw an advert yesterday because I got selected in 2016 when I got ICCR. I got Commonwealth, I got ICCR at the same time. So unfortunately, I didn't go for Commonwealth because of certain reasons I don't want to mention. So I got ICCR. So it's good to apply many scholarships when you are trying to get it. I remember that time I applied for 3 scholarships. I applied for BEA, I applied for Commonwealth, I applied for ICCR. So out of 3, I got 2. So out of 2, I use one, isn't it? So that's why I got my PhD, and it's a good fee. I don't want to disclose that because it was 100% scholarship. I know of many colleagues that enjoyed or benefited from the same scholarship. I have colleagues that benefited from a Commonwealth scholarship. So while in India under ICCR, I still applied for another Commonwealth collaboration that took me to UK for my bench work. They call it split site study, meaning if you are doing your research in Nigerian institute, maybe a master's degree or PhD, you can also apply for Commonwealth to go and do your bench work somewhere, especially in UK. So it's only for UK institute that you can get split site study scholarship. You should write this one. Split side study scholarship. Yeah, so this is another opportunity, especially for ladies. You know, you are married, maybe your husband will not allow you to go for complete, postgraduate studies abroad. So you can do your research here, maybe in Unimed, ABU's area, depending on where you are residing with your husband. Then you apply for split side study scholarship. You go and spend 6 months, 3 months. You carry your husband along, put it in your bag, go with him, study for 6 months, 3 months, depending on the split type given to you. I think that also helps. There are a lot of scholarship out there. Then there is Erasmus Mundus. Erasmus Mundus is also for UK scholarship, isn't it? Now we have for Tanzania, we have for African countries. There are some in-house scholarship, in country. I mean, the one Makato Foundation is only strictly for masters in veterinary epidemiology. Yeah, we are doing University of Maiduguri, our department got one, ABU Zaria, and University of Ibadan. These are three universities that are doing MacArthur Foundation. Is strictly for MScs in veterinary epidemiology if you want to excel in that regard. So thank you so much. There are a lot of opportunities for scholarship out there. Keep searching, keep googling. Thank you so much.
Okay, thank you. Here is another question from Uchechi Gift. About the lecturing job, I heard there is a new regulation that to get the job, you must have master. How true is this?
This is not true. This is not true. I'm repeating because it's not a criteria, But sometimes, depending on the vacant, a department may declare a vacant that they need a senior lecturer or a lecturer one, veterinarian. So the specification in that you must have master's degree. Are you there? So depending on the vacants available in that department, but it's not a requirement per se. I remember there are issues around that some years back when University of Maiduguri stopped employing fresh graduates because once they get another opportunity, they'll just discard the job and go. So it's like you have lecturers today, tomorrow you don't have within short period of time. So they brought that embargo that you must have master's degree. Meaning, if you have master's degree, you are a bit matured and you set up your mind you want to be in academics. Before you go, they must have enjoyed you some years. So these are the reasons, but it's not a criteria anyway. With DVM, you can get employed, especially in fresh faculties. Humanity, you know, Bauchi, Kano, these are new faculties of veterinary medicine coming up. I have seen advert for Bauchi University for veterinarians. So with DVM, you can go anywhere. Thank you so much.
Okay, thank you. Here is another question from Kayode. He said, what are the opportunities that exist in social entrepreneurship?
Yeah. So this is a big question. It's outside the scope anyway. But social entrepreneurship is an area that you can go in, meaning you have to abandon your DVM now. We are not talking of specialty. That's why I say interest is something. So you can go into any of the social entrepreneurship if you think you are competent to do that. Because entrepreneurial skills is something else. Don't count on the entrepreneurial courses you are taking in DBM curriculum. I think that we have to get some extra jobs. Some people are, smart enough to what to get more skills of entrepreneur outside their academia, especially after graduation, when they intend to go into one. So this is my advice, and there are a lot of opportunities. I mentioned telemedicine before. Maybe you can put the things together. It's a kind of social entrepreneurship to me because you are putting your expertise in DVM and now taking into social affairs, advertise your job, entertain people. And not many ladies that they are good entertainers. So they can go into social platform, open their own page. People can subscribe. You can be a YouTube blogger, isn't it? All these are social entrepreneurship, isn't it? You can talk something else outside your profession and you can excel on that. So that's all I have to say. Thank you so much.
Okay, thank you. Here's
Thank
another
you.
question. I think it's the last question. Are there opportunities for vets in technology?
Opportunities for baits in technologies. So it has to be specific, but I think to just cut it short, veterinarians are everywhere, and there are a lot of opportunities even in technology. So let me give you an instance now. With the advent of ICT4D, it's a new ICT technology or IT technology that would give opportunities for health expert to go in. We call it ICT4D, ICT for development. If you want to improve, that one is in short. They call it ICT4D. It's a kind of platform that you engage communities, telling them how certain diseases affect their health, affect their animal health, affect their environment. So in this regard, they need somebody who has knowledge or somebody with biomedical background. You tell them what are zoonotics, how to prevent them, how to control zoonotic diseases. So it's not all about the passing the information, but somebody with medical background. So veterinarians can key in, pharmacists can key in, medical doctors can key in, and other health related personnel. So they call it ICT4D, isn't it? So this area I can say is a technology in approach, and people can do uh, well on that. So I don't know. I'm specifically to fresh graduates because the world is keep changing. You have many veterinarians are coming out. So you have to find a way of differentiating yourself from others. This ICT4D is an opportunity. Thank you for reminding me. It's a kind of modalities for risk communication and community engagement. So these are some of the areas that you can keep technologies can boost. And especially with orthopedics and other obstetrical instruments. Now veterinarians on how such kind of these devices can be developed the right way, isn't it? So you have a role to play in technologies. A lot of instances are there, but we don't have time just to cut it short. So depending on the needs at a time. So thank you so much for that.
Okay, thank you. Here is another question from Daniel Mohammed. He said that while on scholarship abroad, is one allowed to do some kind of side jobs, maybe after lectures to earn more money?
Yeah, of course, yes. I like this guy. Oh. So you're focused. So in UK or in I've been to UK. So their modules comes in such a way that they are designed. They cannot consume all your hours, and there are side jobs available for you, especially at master's level. Because at master's level you have less lectures to do. It's more of research. So you may decide to go for side jobs, updates that you don't go to school or you don't go to your lab for certain works. So, and you can work in more than one place. Let me give you another thing that you don't know, isn't it? You can give 2 hours to this institute or organization. You can give another 2 hours to different organizations. So depending on your available time and your energy, because it requires energy. There you have to work. There is no chua chua in that. If you give them 2 hours, it's going to be 2 hours. If you give them 3 hours, it's going to be 3 hours. And they can give you an opportunity to go for overtime if need be. So you can go for overtime and they can pay you in that. So thank you so much.
Okay, I think that's that's all for the questions today. Before I end this, I would like to thank our hub expert, Dr. Adamu Saidu Saleh, for sharing this with us. Sir, indeed, we are truly grateful for this wonderful presentation. It's very educative and informative because the veterinary world is wider than we expected, actually. And I hope everyone here is going to gain a lot about that. So thank you once again, sir. Thank you to our participants for participating in this. I hope you all have learned a lot on this. Please don't forget to share
so
to your friends and other veterinarians out there. So thank you once again.
Hi, are you a supermarket owner or do you own a veterinary outlet? Aren't you tired of a constant headache looking for a reliable agent who could offer you quality and affordable products? What if I told you that with our services here at Pharmalat, we could offer you quality pet products, reliable service, and zero or no inconveniences at all? Pharmalat offers you the best service there is. Contact us today on the numbers displayed on the screen or via www.pharmalat.shop to create an account with us today. Pharmalat, envisioning animal health.
Have you shopped your favorite dog food today? Have you checked farmalert.shop? Hurry if you have not to www.farmalert.shop. Remember, we offer convenience at zero cost.
It's ODJ. Sure you like us your chicken they die anyhow. Sure you like us your fish they die anyhow. You don't tire to the fumigate to pick up. You don't tire to the lose money oh. Yeah. It's Pharmalat. Don't worry my brother, you go get a lot. Oh, it's Pharmalat. All the sickness for your farm go end at last. Oh, God, relax. Pharmalat don't come, we go help you out. Oh, madam, relax. Pharmalat don't come, we go bail you out. You want your farming to progress. Everything go they make sense with. We go give you training, we go help you. If you want your farming to progress, farming go they make sense when you join. Your livestock no go die. My brother make you join.
This message is brought to you by Pharmalat, providing health care for livestock